Thank you so much, Madam Chair, and thanks to everyone from the agency for being here. It's been incredibly valuable. My questions center around the behavioral health, and particularly the Behavioral Health Solutions Center. I'm wondering, first of all, where the $4.2 million for that center is reflected in the budget, because I'm seeing a couple of transfers to it for $2.3 million. So I'm curious if there's other departments that are maybe contributing budget to that. And then in addition, I'm seeing a proposed expansion. I've heard in the mayor's overall budget letter that we're proposing to expand the center, but I'm seeing a decrease in administration for the center, and then no additional FTE. So just curious about those details. Also curious about kind of taking a step back, if we could get some information on the size of that program, who it's serving, what services they receive, outcomes, and just in transparency, I'm really trying to understand how the Solution Center and also the Wellness Winnie, for that matter, act in our behavioral health ecosystem compared to services provided at Denver Health. And then another bigger question around behavioral health is I looked at the needs assessment that you referenced, Mr. McDonald, and that unsurprisingly identifies a huge need in behavioral health services. I think we all know that kind of anecdotally, concluding that something like half of people who need services are not receiving them. So I'm curious if you all could address how this budget either tracks or frankly falls short of the recommendations in that assessment on how to close that really challenging gap. Thank you, and I'll just leave it there.
Thank you. Director McDonald, do you want to address any of those?
Yeah, I wasn't sure if we were planting that for a follow-up later on.
Some may be, but some may be.
Okay, yeah, no, happy to speak to some of it. I think when we get into the numbers, I don't have the numbers right in front of me. I will tell you that sometimes the budget book can be a little misleading because as funds remain from one year, it's transferred to the next year, and it's a reporting function, and it might show as a deficit or a reduction in something, and that's not really the case. It's $400,000 increase, as I said, for services, increase in services, cost of those services, and FTE merit. There are no city staff. We manage it, we oversee it, but the staff that are there are contracted from Well Power, so we work very closely with Well Power. I'll just hit the highlights of the program. It's intended for people who are in crisis, that might come in contact with a wide range of first responders, paramedics, police, fire, what have you. And the Solution Center is a place that first responders can bring them to help stabilize them. They will be brought into an intake process and have an initial screening, and sometimes the people who are seeking help, it might be nothing more than just a short consultation with a counselor, and then we've got them stabilized and maybe connect them to family members or other resources. Sometimes it stops there. Sometimes we need a little bit more time, or the staff at Well Power need a little bit more time, and they will go through an intake process and be made a room and a bed available to them for 7 days and then be reevaluated. All that time, the staff there are trying to connect them with longer term resources. Then beyond the 7 days, we can move people to a different floor where there are a number of beds for 30-day stays. In terms of we can pull a lot of different metrics in terms of intake time, services provided, how many people were released, how many days were they there. Happy to do that for you. I don't have those numbers right in front of me, but happy to do that. I do know, Councilmember Parady, that you did ask a question about is there funding that goes to first responders to bring them to the Solution Center? No, there's not. It's really a function of their work. I mean, they're going to bring them to Denver Health or bring them to the Solution Center, bring them to the AIDS Center. So we don't allocate dollars specific to that. So far, that hasn't really been the pinch point there, though, that we've been able to work very closely with our first responders to get people where they need to be, including the Solution Center.